generally medicine evolves slowly, but there's one thing that this company's been working on this for about 10 years. It's called, and I don't even know if I'm going to say it correctly, so I'm sorry if I'm saying it wrong, but Jounavx. It's this new medication used for pain. And when we're doing surgery, pain is an important part of the things we want to manage. People who aren't mobile tend to get higher chance of DVTs and PEs. Recovery is slower. We want our patients to be comfortable afterwards. And so postoperative pain control is really, really important. Now, we already use things like Exparel and local anesthetics, but part of our regimen still involves some opioid use, right?
Yep.
Yeah, and so opioids have, they're good for pain control, but they also have some predilection to addiction. They make people feel nauseous. They make people constipated. They do all these things. They make people dizzy. They do all these things that aren't great. And so we're always looking for new things. And this medication is a sodium channel blocker. And not to be too super technical, but sodium channels work to conduct nerve signals. And when you go to the dentist and you get an injection of Novocaine, they're blocking those sodium channels. And when we're using local anesthetic, same thing, right? We're blocking those nerve channels. The problem is it doesn't last very long. And so this is a medication that works selectively on some of these pain receptors or some of these nerve channels to block people's pain. And it does it in a non-addictive fashion. It does it without making people constipated. And the studies have shown, it was studied in bunions and it was studied in tummy tucks, and it was shown to be essentially as effective in tummy tucks as Norco. And so important, we're going to incorporate into our practice. Phil, what do you think?
It's very exciting. Yeah. I mean, they're, opioids, and what we do, we try everything that we can. We do blocks and things like that, things that last longer to try to minimize how much pain medicine that we need. But this could be potentially game-changing. Excited. It was recently FDA approved, and excited to see, maybe in short time, opioids will be a thing of the past for helping patients with pain control afterwards. And so it's super exciting to the times that we live in and being able to offer it and see how it works.
Yeah, and when you think about these medications, again, it took them 10 years to complete some of these studies. And so these are really long-term evolutions. We're incorporating in our practice. I understand that other people see other plastic surgeons. I don't know why, but if you do, you should ask your plastic surgeon about this, because this is a really effective way to get postoperative pain relief. And that's a really important part of your overall procedure and consideration. So that was interesting.
Very interesting, very exciting.
Yeah. All right, guys. Thanks.